Hello, everyone. I'm Sheldon Baker, host of Healthy Bites, brought to you by Innovision Health Media. My guest today is Dr. Keith Berkowitz, the founder and medical director of the Center for Balanced Health in New York City, where he specializes in treating metabolic conditions such as obesity, diabetes, thyroid problems, hormone imbalances, and long COVID and COVID vaccine injury. Previously, Dr. Berkowitz was medical director of the Atkins Center for Complementary Medicine, where he worked closely with Dr. Robert Atkins. Dr. Berkowitz is a co-founder of the Frontline COVID-19 Critical Care Alliance. He is the co-author of Princeton Review's Medical School Companion, The Stubborn Fat Fix, and The Complete Idiot's Guide to Flour-Free Eating. Dr. Berkowitz, thank you for joining me here today on Healthy Bites.
Thank you so much for having me.
So as an obesity expert, we're hearing so much about the use of GLP-1 medications for weight loss. Are there known safety risks if one stays on the medication permanently?
There's two main issues that we look at. One is gastrointestinal, where people get nausea, vomiting, diarrhea, and constipation. And oftentimes, by going slowly and going up slowly, a lot of those to be mitigated. Also, using probiotics and other things to support the gut helps as well. The second part is really muscle loss. Over time, 40-50% of the weight loss can be muscle related. So it's very important to change your diet and adapt where you need enough protein and fat to maintain that muscle.
Can long-term use lead to irreversible stomach paralysis?
Yes, and so what happens is because it works on a mechanism by slowing gastric emptying, it's very important to keep bowel habits regular. So you can get chronic constipation, chronic acid bloating, which can actually disrupt the gut and cause, a blockage over time.
Have you heard about the paralysis issue? Is that something that's become common?
I think if you look at a lot of the hospitalizations, a lot of them are related to more severe constipation and almost to the point of paralysis where people don't go. And I think that's why it's so critical to be proactive, right? To really make sure bowel habits are good before even starting the medication.
From what patients, and perhaps your patients, what they're telling you, what is the actual feeling when that happens?
They get pretty severe bloating where they feel like there's something stuck. Sometimes often they'll get reflux as well because with constipation, the body secretes acid to try and move everything along. So that will be often, but it's more that pressure feeling they feel a lot of times and that they have something that needs to go out, but they're unable to relieve themselves.
So how might stopping the medication affect metabolic health and weight rebound?
So it's so interesting because the medication really works by three main mechanisms, right? The first one is actually suppressing appetite through ghrelin. That's one. It also has a metabolic effect, right? So it's actually making you less hungry, so your body doesn't need to eat as much from that. So by helping glucose and insulin, that is a big effect. And the third one is actually by metabolic adaptation over time, where your body actually feels more full with less food, even above and beyond just the ghrelin, which is your cravings, but by just having the glucose and insulin that's better balanced. And what people see over time is their blood sugar drops. Remember, the drugs were originally developed for diabetes, right? And so the main purpose is actually to control blood sugar and control glucose, which leads to better insulin levels as well.
How about raising the dose? Might that help with the overall weight loss?
So it's so interesting. The answer is twofold, right? Remember, whenever something doesn't work, what's our first step always, right? Go more, right? Go bigger. But the question is why? So it's really interesting. And I actually had a case today which kind of reflects this. A gentleman was taking Zepbound, which is trizipidine, at 2.5 milligrams, was losing weight. Then it plateaued, then was losing weight at 5 milligrams, still, and then stopped losing weight, plateaued again, then went up to 7.5, weight loss didn't happen, then 10, then 12.5, 15, it stopped. So one of the mechanisms that people forget is the body has this thing called homeostasis, or set point. It wants to maintain that number. And oftentimes weight loss is a stepwise, not a linear curve, right? It doesn't go in a straight line. People lose 5 pounds, stop losing for a little while, lose another 5 pounds and stop losing. But what also happens, because it's a diabetic drug, it drops your blood sugar. So critical, right? And one of the things that we work around that is I'm a big fan of continuous glucose monitors. So that really helps to be able to really see what their blood sugar is. And also making sure people eat enough, right? Because when your appetite's suppressed, you actually may not have enough food, and the body may feel that it's in a famine state. And when it's in a famine state, the last thing it's going to want to lose is weight.
Of the patients that you've had who have been on GLP-1, what is the most amount of weight they've lost?
I think you'll see probably about 50 to 60 pounds. I think the people that do, I always say the most successful patient is the patient that loses weight and you didn't know they lost weight. Like you don't know they're on the medication, right? They lost weight at a steady state. And those are the ones that tend to keep it off. So if they lost 50, 60 pounds over a year, they tend to keep it off much longer and better than ones that don't. There's actually an interesting study on that. They actually talked about discontinuation. So what they found within 1.7 years after stopping it, people gained back 100% of their weight. So it's actually, you want the body to have a chance to adapt. And that's why blood sugar is so critical. And one of the things I do, I use actually program a Clarity blood sugar where people can put in their blood sugar numbers and help adjust their food amounts and what they're eating so that their blood sugar stays stable. If you keep the blood sugar stable and not dropping, weight loss is much, much easier and more consistent.
GLP-1 studies with rodents have shown to cause thyroid tumors. Is there also that risk with humans?
I think the risk is in a typical group. People with, it's a C tumors with people with a history or family history of medullary thyroid carcinoma. Those are the ones most at risk. And again, I think risk is also dose dependent, right? So that's why going slow is always better. I'm a big fan of medicine. Slow and steady is always the ones that win, right? If you look at weight loss, right, traditionally, people have lost 1,000 pounds, although it's 40 pounds 25 times, right? They gain it back, they lose it. So you want to make sure someone's losing steady where their body can adapt more effectively to that.
But looking ahead at people who have been on GLP-1, we really don't know what the effects might be. Would you agree with that?
100%. Well, remember, if you look at any kind of medication, right, that you don't know 5 to 10 to 15 years down the road what the other consequences are. And I think that's why, again, medication should be an adjuvant, right? It should never be the primary thing we use, right? You want to use it with good lifestyle, good diet, good exercise. That's where I think the people that do the best. And I think when someone's relying on a medication by itself to really solve their problems, and we know historically, almost every weight loss drug over time has been pulled off the market, right? We've gone through so many rounds of that. And look, even like bariatric surgery, which was so popular years ago, is almost unheard of today. So you want to be able to realize that, hey, it's a tool, but it's not a solution by itself. And I think that's so critical in anything you do, that you want to use every aspect of it and most importantly, change diet and lifestyle to be successful.
So losing a large amount of weight is good, but who should avoid GLP-1?
So there's a couple of groups that you want to, obviously pregnancy, lactation is a big issue. I think the people you want to really also avoid, people with low blood sugar, is one you have to be careful of. That is a diabetic drug. Although that group actually may benefit from microdosing. It's a really interesting drug in twofold. At a higher dose, it's actually more of a diabetic drug, right? Lowering blood sugar. But it actually turns out at a very low dose, and that's sometimes even lower than the dose that the pharmaceutical companies prepare it in. It can actually be an anti-inflammatory. And actually at very low dose, it may stabilize the blood sugar better. So that group it is. And again, you want also someone who's willing to actually at the same time monitor their blood sugar, do the other things around. And you want to be careful of people with a history of digestive issues, right? Who've had bariatric surgery before, who have inflammatory bowel disease, irritable bowel syndrome. Those actually are more susceptible to those bowel issues as well.
Final thoughts, where do you think we're going with GLP-1?
Well, actually, they're now looking at GLP-3. So I think if it's used properly as a tool and used in the right amounts, then it has a positive effect. I think the real key is using the right amounts, is to realize that more is not always better, and that slow and steady is always the key to success.
Dr. Berkowitz, thank you for joining me today on Healthy Bites.
Thank you so much.
And thanks to all of you for watching Healthy Bites.